Dr. Ashley Allen is an emergency medicine physician, surfer, and integrative healer. Alongside her medical work, she also leads Surf Dr. Ash, where she shares courses and support around breathwork, holistic healing, and mind body connection. Her work is shaped not only by her years in high stakes emergency medicine, but by her own experience navigating chronic pain and searching for deeper paths to healing. Let's get to our conversation with Dr. Ashley Allen.
You live in two pretty intense worlds, emergency medicine, integrative healing that you're part of. When did those stop feeling like two separate identities to you? And when did they start feeling like one path?
Yeah, that's a really good question. So I think they started to feel like one path when I realized that I didn't want to have to pick one or the other. And so I had to decide a way to make them work. And so my background was I was a nurse before, but always had a dream of becoming a physician, went back to med school, went to residency to become an emergency medicine physician. And I love the emergency room. I love being able to be there for people when they're in these critical moments of either major trauma or major illness. And at the same time, there's so many patients that I see even now in the emergency room where it feels like what we're doing for them isn't enough, and or it's not really getting to the root of what they're there for. So many people come in with certain complaints like chest pain, belly pain, whatever, headaches, and there's nothing like medically wrong with them. And so then they're left with this dissatisfaction of like, okay, is this all in my head or like what's wrong with me? And that's where I think the energetics and getting into the integrative medicine is really important, because there's so many things that may not display themselves in a like medical diagnosis, but they're still very real. And getting to help guide people through that and like, okay, well, have we explored what this could be pertaining to? Are there any major stressors going on? Any big traumas that have happened? Any emotions that haven't been processed? And getting to see how people were able to identify something that they didn't think was even related. But once they crack that open, almost immediately, sometimes they start to feel better. I was like, okay, this is something that I'm super passionate about and want to do with people outside the emergency room, but it's also something that I can incorporate for those that are here that maybe don't have something that's going to keep them in the hospital, but I want to give them tools to use to help them continue to get better.
As you went deeper into integrative healing, did it start to change the questions you were asking of patients in the emergency room, your approach to that? How did that influence back into more of the trauma setting?
Yeah, so immensely is the short answer. But when you start to break it down, like anywhere in the body, like if you are familiar with the chakra systems or like the energy centers of the body, there's certain presentations that come through when certain aspects of the emotional or spiritual body are trying to get our attention. So for instance, people that come in with heart issues. Yes, someone having a serious heart attack. I'm not going to be like, so tell me about your unresolved emotions with your father, but however, I have had people that come in with an arrhythmia, like atrial fibrillation, where the heart is just like going out of control. They're feeling really crabby. And I put a hand on their chest and I have them take a couple deep breaths with me, and they start to have an emotional release, and within minutes their heart is back in a normal rhythm again, and the nurses are like, what just happened? Like they come in with the meds. I'm like, actually, I don't think we need them anymore. Right. And it happened when I was first starting to play with this in residency. I came across a book by a person who's now one of my mentors, Steve Bierman. He's a former emergency medicine doctor who wrote this book, Healing Beyond Pills and Potions. And in that, he does a lot with like just the mind body connection and getting people into a place of like not full hypnosis, but kind of taking them out of themselves a little bit and just playing around with that a little bit in residency. I was like, oh my gosh, like this is magic, actually. Like I can get someone to have a painless procedure by having them envision themselves in one of their favorite settings and get really detailed about it. And then all of a sudden they don't even notice that I'm pulling on their broken bone, So I kind of am rambling a little bit, I think,
No,
but
no, not at all. It's that idea of almost just being like to be able to contemplate what's happening
Yeah.
without going so deeply into it that you're living every single emotion of that.
Mhm.
Let the mind be in a place that it's comfortable and familiar
Mhm.
so you can do what you need to do and they're not just fixated on it. Makes total sense.
Exactly. Exactly. Yeah. And one of the other things that I love to do that I learned from Dr. Bierman as well is when someone comes in pain and they're very fixated on this part of their body that is in pain, you don't use the word pain. Like you say it once to kind of buy in with the patient, like, yeah, I know you're hurting. And then you start to look at the parts of the body that are comfortable. And you're like, okay, I know this is where it's bothering you, but I want to see how this arm feels or this leg or your belly on this part that is comfortable. And you plant the seeds of them acknowledging the parts of the body that are safe and comfortable. And all of a sudden, by the time you get to the part of their body that was really bothering them, you're able to do a full exam without them flinching. Like it's really cool to see live time how our bodies can shift when we put our mind in a place of comfort and safety instead of this like fear and pain
Yeah.
that is a lot of what presents in the emergency room.
And it's so interesting too, because there's a real evolutionary reason why we'll fixate so much,
Yeah.
right? That's pain. I need to address that. But then what you're also doing is that same idea of, yes, that's happening there. Now let's talk about you as the whole, as the system, and how these are integrating together.
Mhm,
Yes, we acknowledge this. We know this is
mhm,
happening. Now let's step back from that acute component of that and see it as the whole. I mean, that's where those two interact so much, right? That emotional, we hear mind body so much now.
mhm,
It's almost like it
mhm.
just, what does that really mean? But that in its essence is exactly what's happening right there. That's
Yeah.
amazing.
Yeah. Yeah. And it's really cool. And even people who come in really critically sick, planting the seed of like, hey, uh, you've got a lot going on right now, but I want you to tell your body, okay, body, thank you for the message. It's time to start healing. And I'm not kidding. There are people that I was like, oh man, I don't know if they're going to make it. And they're pulling through and they're starting to get better. And it's, yes, some of it is the medicine and the treatments that we're doing and the interventions, but beyond what you would expect from those interventions alone, they're like improving. And so it's so cool to see that. And, I think it's still a challenging time in medicine because like there's more and more science coming out to support energetic medicine, to support the importance of the mind body connection, how we speak to ourselves, how we acknowledge our bodies. And at the same time, it's still a little like, ooh, this is like a little woo woo, or like you can just think away your pain. Who are you? And it's like, yes, you actually can. Like, but it's still a challenge to be like, okay, how do I get to use these practices with patients and still be credible in their eyes as a physician when I'm talking about things that they never would have in a million years expected to come out of their doctor's mouth.
I think that's what's so powerful about the position that you're in, though, because you do live in both those worlds. You come with inherent integrity. Not I did this 20 years ago. There's still
Yeah.
validity to that. No, I am
Yeah.
actively doing this right now. I'm seeing this on a day-to-day basis, and this is what it means. It gives them license to open
Mhm.
up, right?
Yeah.
And still have the validity behind it. And also earlier what you touched on is like seeing patients pull through on something more than just the medicine should be supporting. I think an important aspect of that is like you're giving them permission to see the path to wellness,
Mhm.
not just pain, pain, pain. I'm dealing with this. I mean, that's just that emotional overwhelm that we all can feel at times, but you're telling them, yes, and we're doing concrete things here, but let your mind go to this place
Mhm.
where you're on this path to wellness. It's already started.
Yeah. Yeah, 100%. And Dr. Bierman and other practitioners in this realm talk a lot about the importance of authority. And so for me or other practitioners, we are seen as the voice of authority. So what we say matters exponentially more than what their families say, what they say to themselves, until you get them in line with what you want them to be saying to themselves, right? So the whole concept of like placebo or nocebo. So placebo is like planting seeds and like improving someone's outcome just based on thought alone. And nocebo is like negatively impacting them. And so it's wild. Like And so when someone's about to get an injection, someone's like, okay, this is going to hurt. Like, well, yeah, of course it's going to hurt. You just told them to to power up
Especially now.
for the painful experience. Right. And so like everything that we say matters so much. And it's not to put so much pressure on like, oh, you have to speak perfectly every time, but just knowing that like us, like you said, us giving permission, like, hey, I know you can do this. We have all the tools to help you get there. And together we're going to get you better, gives them permission to think about the positive, to think about how good things could go. And, some people are like, oh, that's just like it says like way too optimistic, or you're like, I can't remember the word right now, you're sugarcoating it or whatever. And it's like, okay, so what's
Results, results are results.
wrong with that if it works?
Yeah.
Right? Like if it doesn't work and if I'm like just creating a situation that's impractical, sure. But like we're giving them real tangible things that they can hold on to that help them get better, and seriously, it can be life and death sometimes. I remember, I will never forget him. There was a guy who came in with a massive heart attack, like in his 40s and super sick. And I was just a medical student at the time, or no, I was a resident, and I didn't have a main role in his care except for I was just up in his ear saying, hey, you know what? I want you to tell yourself you're going to get through this. And I want you to see yourself on the other side and see your family and how good you're going to feel once this is all over. He had to get shipped out from that hospital. He made it right to the door of the cardiac suite and he lost his heartbeat for a minute, but they were able to bring him back and get him through the procedure. And, I can't say, oh, it's because of what I said. Like, there's no way to like say that, but like, I would like to think that planting that seed was enough to get him to hold on just long enough until he got to where he needed to be,
Even
and
just taking him out of acute
yeah,
stress
yeah,
and de-emphasizing this overuse or
yeah,
overstimulus, even if you will.
right,
Just reserve that energy,
right,
reserve your focus. I mean,
right.
sometimes it only takes a little
It
bit.
just takes a little bit, right? Hanging on by thread is a phrase for a reason, right?
Yeah, exactly. So when you've spoken about when you were in residency and you were dealing with debilitating migraines and sciatica, can you take us into that season of your life a little bit in your path and like what was happening and what started to change in a way that you thought about healing in a different way?
Yeah. So, I mean, I was at a point in residency where I was having almost near daily migraines and they were debilitating. I couldn't see sometimes. I would be throwing up a bunch, hardly able to get out of bed, but still expected to be at this program for 60 hours a week and having to find a way through. I was taking all these different medications and nothing was really helping. And I remember being hooked up at an infusion center and looking around at all these like chemo patients. And I was like, this is not my life. Like, I'm supposed to be out and hanging out with my kids and surfing and working and doing all these things. Like, this is not it. And a friend happened to mention someone who she had heard about through the water brewery, this woman, Natasha Davison, who does BEST, which is bioenergetic synchronization technique. And I was like, you know what? I have nothing to lose. Like, let me just try it. Nothing else is working. And I went and did one energetic session with her. And I'm not kidding when I say that I went from sometimes 5, 6 migraines a week to in the past 2.5 years, maybe having 10, 15 total. And I can meditate out of them now.
Wow.
And I like my son one time when I was struggling with one a few months ago was like, did you take anything? I'm like, oh yeah, I could take a Tylenol, couldn't I? It's gone to the point where I
Right.
don't even use any medication at all. So I kind of forget it's even there. And so it gave me my life back. It gave me my ability to function not only in my job and in the emergency room, but also in my life, like to not be in bed all day. And I was like, oh my gosh, if this can work for me, like it can work for everyone. I had super resistant migraines that my neurologists were troubled trying to figure out what they could do with it. And to find this door to this pathway that didn't have to involve suffering so much was just incredible and really got me going on like, how can I use this to help other people and how can I use this in the emergency room?
I think what's really powerful about that too is that activation of those integrative healing components and doing these other paths, de-emphasizing even simple things like Tylenol, ibuprofen, whatever,
Mhm.
also makes those that much more powerful because you're not over relying on them. So
Exactly.
that's again a path where these integrate. I think sometimes this conversation gets to be this or that, which I think
Hmm.
doesn't do any of us the benefit of how these again integrating together, de-emphasizing medication or this mindset
Hmm.
of I take this and it solves my problems,
Hmm.
taking ownership of what's going on and being aware and seeing some signs, early signs. And then when you get to this place, like, oh yeah, this Tylenol does help me at this place when I'm
Hmm.
doing these other modalities and
Right.
integrated pieces.
Right, exactly. And that's just like you said it perfectly. It doesn't have to be one or the other. And that's part of why I find myself in both worlds is I'm like, you still need, emergency care if you have a perforated appendix.
Yeah.
And there's some actually people out there who have healed their own without medicine, but like for in the general sense, like
Yeah.
there are times and places for antibiotics and for fracture reductions and surgeries and all these kinds of things. However, I think as a whole, we have become so desensitized from the messages of our bodies
Huh.
that then I'm getting all lit up even talking about this.
Yeah.
Like they have to scream at us to get our attention.
Yeah.
And then, of course, things aren't going to work. And then, of course, we're going to be taking a gazillion different things for this and that and the other thing because we have become so dysregulated from the messages that have been whispered at us until they couldn't be heard anymore in that way. And so, in my own experience, it got me back to a place of just immense sensitivity where, like, I can feel just a little bit of something off and I'll start to investigate
Yeah.
so that it doesn't get to be a major problem. So I'm able to like find out, oh, I guess this is bothering me. Let me sit with this for a little bit in some meditation, or let me do some breath work and see if I can clear this, and then start to progress if needed. And most of the time it's not needed, and being able to teach people about, hey, did you know that grounding, something as simple as putting your feet in
Yeah.
nature for 20 minutes a day can reduce your blood pressure, can regulate your blood sugar, can help you sleep better, can help your mood? Did you know that? And most of the time they look at me like I'm crazy or
Yeah.
like, why are you telling me to go put my feet in the ground? Aren't you supposed to give me a medication? I'm like, this is the medicine, you
Right.
guys. Trust me, do this every day for a couple weeks, recheck your vital signs. I bet you're going to see an improvement. And there's studies that are showing this stuff now. But, we've gotten so used to this model of something's wrong with me. I need to go find a pill to fix it. And sure, that works kind of, but it's not the ultimate answer, I think, of like really getting us to a point of health and wellness.
Yeah. It's just
Yeah.
interesting. It's like the coin looking from two different ways. Like earlier when you were talking about coming in right to the ER and being really fixated on something and the stress of that and the pain
Mhm.
of that being amplified. And then what we're talking about here is ignoring things to the level where they have to scream at you
Right.
and then coming into it. And then I'm sure you've seen this in patients you've been working with. I certainly see it in clients is people start to go down a path where they are more aware and they're starting to, and then they start seeing things that maybe aren't to the level that really is happening, or they're seeing things that aren't even really there. That's why
Hmm.
this is a practice. That's
Hmm.
why living in this and really getting to know those signs so you can focus on the priorities and let
Hmm.
go of the things that aren't there. It's both sides of that. It's such an
Yeah.
interesting part. That's the activation of it, right?
Right.
Being empowered by it and not overwhelmed.
Right. Right. And I think that, at the root of so many different things that people come in with is unmanaged stress, unresolved emotion, unresolved or unexpressed feelings or interactions that just haven't that they're holding on to instead of expressing the way that they need to. And it sounds so like simple, or like people think you're just writing it off as like, oh, you need to reduce your stress. I'm like, no, like truly, like if you're living in today's world and you're not like out in nature somewhere, like you're probably experiencing a little too much stress for what your body is supposed to handle. And so, yeah, getting more in touch with that and being able to reduce that. So then you're not having to chase all these different things or worry about all these different issues. Like, eh, it seems so simple because it is, but it's so hard for people to do because they overlook it for its simplicity, if that makes sense.
And we also live in this world that we have little slot machines in our pocket that are
Yeah,
constantly,
right,
constantly, constantly
right,
vying for our attention. And they have that figured out. These are not unintelligent people that are
right.
putting so much money into keeping our attention. And we could go down that path of good,
Uh-huh,
bad, and
yes,
it's
we could.
balances of both, of course.
Join us for episode 2016. Yeah.
Right, 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 exactly.
Seriously.
But I think all of us kind of understand that. And
Yeah.
then the question is, how do we compartmentalize that? How do we
Hmm.
find that? Which is, I think, what we both find that a lot of the people that are listening is that that's what surfing is for us, right?
Hmm.
So
100%.
as both a surfer and a doctor, when do you feel surfing becomes medicine?
Mm.
And when can it become another way people override what their body's trying to tell them? And what I mean by that is
Mm. Yeah.
we're out there surfing, right? It's so ingrained in us how important this is to quality of life, mindset, physical strength, all of these things, emotional health. But in a session itself, right? You use the cloud break example. It's firing, you're right there. And then these signs are starting to come in like,
Mm.
hey, you might be getting to that point of fatigue. Maybe your risk is
Mm.
starting to elevate. And that's
Mm.
something I've thought about more, certainly with what I do in training with people, is we're preparing for this really amazing thing that we want to keep in our life. But sometimes it's that balance like everything else. So touch on
Mhm.
that. Where's tripping medicine? Where is it a distraction in the moment?
I'd say it's 95% medicine.
Yeah.
Like, I'm like, I don't, yeah, man. There's never a time where I'm like, oh, did the wrong thing by going surfing today,
Yeah.
And
Yeah.
I think just, seawater alone is so healing for the body. And especially for women, there's like more and more studies finally coming out on like the healing properties for women's bodies and our makeup in general or in specific. And being out there, even if you're not catching waves, is medicinal and is therapeutic, just being able to take in what's around you, whether that's just silence and the waves and the dolphins and the sun, or getting to catch up with a friend that you haven't seen in a while or that you see every morning when you surf with them, whatever it may be. That community aspect can be really healing too. I think as long as we're listening to our bodies and we know our limits, if you're pushing yourself when you know that, like, hey, I should have taken that last one in, and there's like some pride or ego or something else that's pushing you to do it, then that's probably not the right move. But like, yeah, it's a very small percentage. I think in general, like if you're doing it because it helps you feel good and alive and it keeps your body moving and it gives you connection with nature, like I don't think there's such thing as too much.
Yeah.
You're gonna wipe out, or you're gonna like start to not be able to paddle as well. Your body's gonna tell you when it's time. And so as long as you're listening to that, like I think you can keep yourself from catastrophe. So
And we'll be right back. If you've been listening and know it's time to take your surf fitness seriously, I'd love to invite you to explore my surf exclusive coaching program. This is high level, fully customized coaching designed to unlock more strength, endurance, and mobility so you can keep surfing at your best. I only take on a very limited number of surfers because the attention and personalization is deep. If you're curious whether it's a fit for you, reach out and we'll connect and map out a personalized plan just for you. Go to surfstrongfit.com/start. Now back to the show.
In that thought right there, talk a little bit about what you do away from the ocean to prepare your mind, prepare your body. to keep it in your life for the long term?
Yeah, I think one of the big things is, especially when I'm not in the water, is yoga and stretching, like, doing some sort of movement in the body and with the breathing aspect of that as well, I think is super important for me. Grounding I usually like sit on the beach or like will stand and stretch on the beach for 10 minutes or so before I get in. Sometimes I'm like, my
Yeah.
body will figure it out as I get in. I think that just keeping that state of presence that comes with surfing is something that's really important, even when you're not in the water. Like I love that about it. It automatically disconnects you from everything else. I purposely don't wear a watch or anything else that's going to tether me when I'm out there. And same thing when I'm on land. I'm always on do not disturb. I look at my phone when I need to, and just keeping that sort of detachment from the grind and from the slot machine in our pockets, I think has been really important for me just with everything that I do. I know that doesn't work for everyone, but that's my system.
We can do more than I think all of us do to
Yeah.
improve. It's a balance of everything, right? But again, back to it, it pulls us in. It's designed to
Hmm.
do that. So
Hmm.
just really kind of thinking about preventative, what are the structures in which we do that? Almost in the same way that you're like, what do I need to do around my surfing to make sure that I keep that available to me?
Hmm.
How do I schedule it? Do I talk to friends?
Hmm.
Do I make commitments? The joke I always use is, when in doubt, you always paddle out. It's the same
Yeah.
idea. It's like you have to keep space for it.
Yeah.
Just like the phone, like you have to keep space that has stillness in it to let
Hmm.
us slow down because
Hmm.
I mean life is fast for everybody.
Right.
And you
Right.
just have to do what you can to slow it down because it's
Yeah.
only right here, of course.
Yeah. Yeah, 100%. And there have been days where I literally had 5 or 10 minutes and I was like so bummed that I was missing on surf. And I'm like, no, I'm still getting in, and just make the most of those 5, 10, 15 minutes. Those have honestly been some of my best sessions because I'm so determined, and it's just like I'm going for every wave instead of like waiting and taking my time. And I've had so much fun. And I think you nailed it, that like if it's something that's important to you, you have to consider it something that you need to continue carving out time for and space, because it's almost like I'm single, but it's almost like a marriage, right? Where I'm married to the water, and I can tell when I've been away for too long. There's some repair that needs to be done. And so why not keep it something that is like a priority, especially when the trickle down effect from keeping that in your life as a priority is so beneficial. I'm such a better person when I'm surfing, and, when I'm doing it regularly,
Yeah.
in, I would say, almost all aspects.
Yeah, absolutely. I've repeated this so much, but like we're just better versions of ourselves when we
Yeah.
have that in our life. We're
Yeah.
better husbands, fathers,
Yeah.
mothers, daughters. I mean, go down the
Yeah.
list. And
Yeah.
it's very much about that idea of, yeah, it's presence. It's all the things that we know inherently. Saying that out loud to ourselves, I've found to be a really powerful
Mm.
thing because we do get distracted. I'll have people
Mhm.
start working with me that maybe have surfed most of their life or, and they haven't been doing it recently.
Mm.
And it's like, well, how did you get there? Well,
Mhm.
I just was suddenly I wasn't surfing anymore.
Yeah.
And of course it feels that way, but it's like anything in life, right? It's very small positive progressions,
Mhm.
very small. I wouldn't go as far as negative, but
Yeah.
absence of something.
Yeah.
And that
Right.
gets reinforced. And
Right.
I think that's true across almost everything in life is this idea. And what I do obviously with movement and breath and mobility, I always just talk to people about you can find 2 minutes. You literally
Mhm.
have it in
Mhm.
abundance. If
Yeah.
you look at it as totality,
Yeah.
your
Right.
mind shuts down.
Right.
But
Right.
you have 2 minutes, do 5 push-ups and 5
Yeah.
squats. That doesn't
Exactly.
sound like much.
Exactly.
Done
Right. But
repeatedly
it's
is
something, right, and like
so
you said,
powerful.
yeah,
Absolutely.
absolutely, and the more that you do it, the more that it becomes your routine and your practice, like, absolutely,
And
yeah.
it just reinforces those things, so you start looking towards that, you start seeing
Mhm.
that. Of course, it then positively influences your ability to surf, which just reinforces your
Right,
experience
right,
there, and it's just this whole cycle together.
yeah.
And we're oversimplifying a little bit, of course,
Sure.
but if you keep your mind likes simple things. And
It
so
does. It really does.
if
Yeah.
you keep it in there, then it allows you to get to what's might seem more complex. Just like we talked about earlier, like ownership of this path of wellness. If you're
hmm
looking at the end result, it's okay. You want to have a goal, you want to have a
hmm
direction, but you
hmm
can't look at the 10th step. You look at
Right.
the first step.
Right. And especially when it's taken you 10,000 steps to get where you are today, that can be, like you said, it can be really overwhelming for someone. So it's like, okay, well, what can we do right now? In this moment, I want you to take a couple breaths and envision yourself in 5 years with your perfect health
Yeah.
and all the people that you love around you. And like you're in your favorite place, you're eating your favorite thing, you're listening to your favorite music. Just feel that for a couple minutes. And even just getting someone to do that for a couple minutes, it's like, okay, it gives them that time to reset. It gives them something to look forward to. And then they're like, I know what I could change today. Like it's almost immediate. There's like some sort of clarity or download, like, oh yeah, I could take a 5 minute walk today outside instead of like sitting on my couch, like, or I could eat one thing that is a little bit healthier for me today instead, like instead of doing a massive rehaul and overhaul. I think that that's where people get stuck, is like you said, small little things, like finding just a little something to carve out that's on the pathway towards the direction that you want to go. Yeah.
How much more effective that is when it's devoid of the traumatic incident that forces people to completely
Right. Right. Yeah.
that is like, this has happened. Now I
Right.
have to do these things.
Right.
It's harder to see that it feels more existential, if you will,
Yeah.
when it's in those little small little compartmental steps.
Yeah.
It's much easier to just go,
Yeah.
okay, I'm doing this, and now I'm
Yeah.
doing this, and now, and then
Yeah.
suddenly you look back and it's like, how did I get here? Oh my gosh, it's
Yeah.
amazing.
Right. Right. And like you said, I mean, if I had to pick between having a dramatic slam down, like you don't have a choice, you have to rebuild your life, versus maybe we could do this a gentler way. Like I've done both routes and I can say that like the gentler is better, guys. Like,
Yeah.
so take the time now. Do something for yourself now that is small and incrementally build, and you will thank yourself over and over infinitely, because you avoided that massive heart attack. You avoided that like debilitating stroke. You avoided some horrific accident that like there's just so many things that are avoidable if we listen and
Yeah.
if we follow with intention in the direction that is towards our benefit.
Yeah, absolutely. Well, you kind of we kind of are touching on this right now,
Yeah.
but this question that I have is, when someone does feel overwhelmed like that, they
Mm.
feel stuck, they feel disconnected, it can be hard to imagine that way forward.
Yeah.
In your view, what does beginning a healing journey actually look like? And what's one important first step that we just talked about that people can take to
hmm
start that journey?
Yeah. Um, it's a wonderful question. I think the biggest component that has to be there is they have to believe that it's possible. I meet so many people who are so stuck in their narratives of being ill and diseased. I'm like, okay, I can't help you. I can help you. I can accommodate and ameliorate certain things, but like you're never going to find true healing if you're not looking for it or believe it. I think the first step is believing that it's possible, even if you're like, this seems, like a pipe dream, but it's possible.
Yeah.
Planting that seed of possibility and belief and envisioning of a future self that is in a healthier state is super critical. And, it's, if we let ourselves dream, our dreaming mind is so powerful, right? Like whether that be in a state of envisioning or whether that is in our dreams, like when we're actually sleeping, there is no limit when you're there. And if you're able to give yourself that little piece, that opens up everything. I think that that's the first most important step. And I think too, in like, okay, what is the first step to take is starting with the simple things, starting with like, can you incorporate like a 2 minute meditation routine? Can you incorporate 5 minutes out in nature? Like, even if it's just on your grass or like on your hardwood floors, like, can you give yourself, like you said, can you find 2 minutes? Like, same kind of thing. Can you start with this and then build up? It doesn't have to be this like massive overhaul, although when someone starts versus what they look like at the end is going to probably be fairly different. Um, it doesn't have to be big to start. I think it's just acknowledging that, like, hey, something's not working and this isn't what I want for myself and I envision better. That's like the most important starting point, I think.
Yeah, absolutely. I think we've touched on it a few different ways, but it is so powerful and important to repeat, which is where you are. I'll always like to think of it as neutral. You're in this neutral state, pulling away your judgment of good, bad, positive,
Yeah.
negative. You're here, you're in this place. And
Mhm.
that idea of the ownership of your path of wellness, that positive progression, those small steps, it's always those small positive steps. And you want to acknowledge what you've accomplished,
Yeah.
absolutely. And you want to know where you're going, where you
Yeah.
want to go. But
Yeah.
both those things, then you let them go. And you're now right back in that neutral state. And pulling away that judgment is hard. It's really
Yeah.
hard
Yeah.
for everybody, including us,
Right.
by the way.
Right. And it's what keeps us sick,
Yeah,
you
yeah.
know?
And just
Yeah.
being in that place and like, this is what I have to do now. This is what I have to do right now is take this, literally take a step out the
Mhm.
door, or
Mhm.
literally take a big, deep nasal diaphragmatic breath. Whatever that thing is just being right there in that place. And you have a choice to make that positive step. You always have ownership of that.
Yeah.
And that we lose sight of that pretty quickly.
Yeah.
Yeah.
Yeah. 100%.
So you've created some work specifically for healthcare providers like yourself that kind of deals with like the burnout component and how they can deal with their wellness. What do you think people in healthcare are most starved for right now?
Oh, man, that's a really good question. I think it's such a big industry, so it's hard to say what everyone is starved of. I do think that there are some of us, and maybe more than not, that are getting dissatisfied with the lack of like positive outcomes that we're able to provide people. Yes, we still, we meet our metrics. Um, and so I think that's where I find that the integrative component can be really powerful. And at least for me, it gave me my purpose back, where I realized that, yes, maybe I'm not able to help them heal all of their medical conundrums today, but I'm able to plant a seed that like something is possible, or I'm able to help them with this one little aspect, or I'm able to incorporate something that they've never heard of before and now can take as a tool moving forward. So, of course, I'm biased, but I think that putting more emphasis on the integrative components of health and wellness would be really helpful for those that are in the healthcare profession, because there's no one that can't do breath work. There's no one that can't do visualization. I mean, if you have a mind that is able to follow gentle instruction, if you have a diaphragm that you're able to breathe on your own, then you can do these practices. And getting to see the results of that has been so rewarding for me, and I would love for more practitioners to see that. But I don't think I can say that that's what they need, because a lot of them don't even realize that it's out there.
Let's take that same question and concept that you were talking on there about what they're seeing in their professions and around them. And let's turn that lens around to the individual. What do
Mm.
you see as obviously the COVID era of things and all of that came that within healthcare workers themselves? What do you see as what they might be lacking in their own wellness, be that
Mm.
stressors from the job itself, or what are some of the things that those individuals could use for their own health and wellness?
Yeah, I mean, hands down, I would say a mindfulness practice. Like in general, we talk about certain things when we're there working, but it is very rare that I come across someone who seems to have like a meditation practice, and or that is in touch with that part of themselves. And if they are content and they don't feel like they're missing it, I can't say that they need it, but
Right.
my goodness, it has changed my life for the better. And I think it helps to process the stress of the jobs that we do so much, to have that grounding practice. So that would be something I would say that, is missing in a
Yeah.
lot of individuals in the healthcare setting. But, you know, That's also just an observation without.
Yeah. Powerful though, powerful. When you see in your, your week and you're on shift in the ER, have you developed, obviously you spoke of mindfulness and, meditation. Have you created tools for yourself on how to process that level of stress, process that level of exposure to people on their worst days? And while not necessarily separating yourself from that, but then coming back into your own life, like you mentioned your kids and your surfing, how to process that in as healthy a way as possible?
Yeah, for me, throughout a shift, I'm taking grounding breaks. I purposely hydrate
Yeah.
really well so that I'm forced to need to have a bathroom break, which I
No,
don't deprive myself of. And that gives me a couple minutes to just breathe and recenter, like throughout my shift. Or after a really hard case, I'll take a few minutes. And especially, if there's a loss, like even as a group, we'll take a couple minutes to like just process and have a moment of silence and a debriefing. I think that that's something that's really critical in these high impact scenarios and situations. Beyond that, for me, I spend, I purposely work places that are a little far from home, so I have that time in the car driving, decompressing, like either I'm listening to something or having total silence and just the windows down, having that space and time to process and to let go and shed whatever emotions came up. And then too, acknowledging that, they're not gone as soon as your shift is gone, and sometimes it takes a little bit more of revisiting over time, or something will come up and I'll think about a patient or a situation even days or weeks or months later. And just anytime it's coming up, giving it a couple minutes at minimum of space and time to sit with what comes up. I think number one, it's really honoring to the person and the patient that we had and took care of and their situation. I think it's also so important to remember that we're humans and not just robots going through and doing all these things. So, though I surf as much as I possibly can, my yoga practice, like all of it is my medicine that helps me to stay centered and grounded in what I do. And I can't emphasize it enough, like how important like it's seriously, it changed my life. I was like burnt out, all these crazy migraines in residency, not knowing how I was going to even continue residency and how, especially how is this going to be my profession and my life if I like can't sustain, and shifting over into carving out more time for meditation and mindfulness, carving out more time to process whatever emotions are coming up over my patients in the different cases. It's life-saving. It's burnout preventing. It is imperative, and for anyone who wants a career that's going to be more than a couple years.
yeah. As you look out in the work that you're doing in your integrative health side and with Surf Dr. Ash that you look out in your vision of that. What does that look like as you move forward on this professional and personal path?
Yeah, I mean, my ultimate dream is to have integrative healing centers all over the world. Not that it needs to be me doing them, but I envision that for our future, having these places where people can come and see an MD if they need something that is of the Western side of things, like a prescription or lab draws or whatever else, or they can start their journey into looking at all the different modalities of integrative healing, or they can continue it and use them in concert. That is my ultimate dream. I would love to be able to do retreats. I've had visions of having like wellness festivals as well. So, and then also just working with people individually or doing classes so people can start to learn about the stuff that they're not already aware and continue to build on that. Those are all things that I would love to see in my future.
Yeah, absolutely. So if you could go back and sit beside the version of you when you were in residency who was hurting and trying to hold it all together, what would you tell her now?
Oh man. It's funny because I think she knew this then too, but
Huh.
I would tell her it gets so much better
Yeah.
and you are exactly where you need to be, doing exactly what you need to do, even though it doesn't feel like it right now. Yeah, you are needed in this field. You are needed in this arena, and you're needed to have these personal experiences with pain and suffering so that you can help people get through it in a different way that others that haven't experienced it can't.
That's great. Ash, thank you so much. This has been
Yes,
awesome.
thank
It was
you.
really great talking to you. And
Thanks for listening to the Surf Strong Show. Our mission is simple: build a healthier surf community and help you surf strong for life. If today's conversation gave you something valuable, share it with a friend and help spread the movement. For bonus programs, surf-specific training, and ways to connect directly, head to surfstrongfit.com/start. And if you're ready for high-touch, customized coaching, reach out to see if you're a fit for my surf-exclusive program. Until next time, train smart, breathe deep, travel far, and surf strong for life.